And welcome back. It's about 6:39. All month long, we've been bringing you back to school coverage, and many students in San Antonio are probably still getting adjusted to the classroom.
A lot of them probably still adjusting from their summer sleep schedules as well. We welcome back Dr. Samiya Ahmad, a pediatric sleep specialist from Children's Hospital of San Antonio. Good morning, Dr. Ahmad.
Good morning.
Good morning. And for many kids in San Antonio, it's only the second day of school. So this morning, a lot of parents may be struggling to get their children to shift into a normal sleep routine. How can parents identify whether their child is just being resistant or if they're suffering from a genuine sleep disorder?
Oh, great question. So if it's only been 1 to 2 days, it's not enough time to become a sleep disorder. Depending on what kind of a sleep disorder it is, it would have to take it would have to occur about several times on most days for at least 3 months to meet the criteria for a sleep disorder. So I would recommend keeping up with a good sleep hygiene and the regular bedtimes and wake-up times. In addition, keep a sleep diary to document the sleep times and how long it takes your child to fall asleep. And if you still notice a problem after several weeks or months, then reach out to your doctor that, hey, you know what? I think my child might have a sleep disorder. And also remember, a sleep problem, it has to be problematic to both either the caregiver or the child in order to become a sleep disorder.
Dr. Ahmad, let's say that parents have tried just about everything to get a sleep routine going, but they haven't had luck. When should they consider sleep aids or medication? And should they maybe consider enrolling them in a sleep study?
Oh, okay. So first, I would recommend before medication would be to work with light and darkness to help your child fall asleep. So dimming lights an hour before bedtime would promote the natural secretion of melatonin. And melatonin is the sleep-inducing hormone that's secreted by the pineal gland, which is at the base of the brain. Now, if they're tired in the morning, I would recommend exposing the child to natural sunlight, something that we have plenty of in San Antonio. And the light actually suppresses melatonin secretion and therefore promotes wakefulness. Now, if the child is still sleepy, parents can try using a light therapy lamp and have their child look at that lamp for about 15 minutes in the morning to get them up and going. Now, if these measures still don't help, over-the-counter melatonin can be tried in low doses, like about 1 to 3 milligrams 30 minutes before bedtime, and just use it for a short amount, maybe a few days or a few weeks. Now, before going on to a sleep study, I would recommend evaluation by your doctor for other causes of difficulty sleeping, such as things like ADHD or constipation or eczema or other medications that may be hampering your child's ability to sleep. Then your doctor can decide if your child needs to have a sleep study. And most often, the reason that a sleep study is ordered is if a child is snoring or stops breathing in their sleep or has disturbances in their sleep at night.
And we're talking about sleep studies, one of the bigger topics on parents' minds right now, of course, the coronavirus. And as we continue to see a rise of cases here in San Antonio, there's probably parents who feel kind of uncomfortable taking their children into a hospital or doctor's office right now for that sleep study. I know you talked a little bit about it, but are any alternatives you might recommend?
Oh, yes. So there are actually lots of alternatives. So if you just want to talk to your sleep doctor or your PCP about these conditions, you can do a virtual visit. And sleep problems are great for discussing over a virtual visit. Of course, a sleep study has to be done in a sleep lab. Now, adults can do a home sleep study. So if your child is like 18 and older, then, they can do that home sleep apnea test. But most of the kids I think we're talking about are younger than 18. So insomnia, which is difficulty sleeping, does not actually require a sleep study for diagnosis or treatment, but other things like sleep apnea or movements in sleep do warrant a sleep study. Like I said earlier, the most common reason for ordering sleep studies in children is obstructive sleep apnea, also known as OSA. And parents are appropriate to be, concerned about risk for COVID-19 by doing a sleep study in a sleep lab. So OSA is when a child pauses in their breathing when they sleep, and this causes disturbed nighttime sleep, and it can also have daytime repercussions like inattention and hyperactivity. And so if you have these concerns and you want to wait to get a sleep study, take a video of your child sleeping and show it to your doctor. Your doctor can look very carefully and see if the child is struggling to breathe or is pausing or snoring. And then your doctor may want to give you a validated questionnaire like the OSA 18, which can assess your child's risk for OSA. And they may perhaps draw a few blood tests that look for inflammation that is associated with OSA. You can also try some over-the-counter nasal steroids, see if that helps with their sleep.
All right, Dr. Ahmad from Children's Hospital of San Antonio, thank you for your time.
Thank you.